so this is what I did. Remember, incisions, like whole pounds talked about, large incisions around the world, go around and debride it, techniques to tap it out however you want to do it, to tap the implants out, and then was stabilized with a 1.5 exchange. Again, high doses of antibiotic cement. I use a lot higher, more like 7 grams, but to do that, I add 11 cc's, I just figured it out, 11 cc's of saline, then mix the monomer, and then put him off. And then he goes home on post-operative day 5, oral antibiotics only for 4 weeks. So this is where we differ from the East Coast, from the West Coast, antibiotic brachytherapy, which is treatment of antibiotics in the hospital only, no PICC lines. I haven't used a PICC line since 2019. I send them home with oral antibiotics for 4 weeks. And in 1.5 exchange, not all 1.5 implants need revisions. They can last a long time if you use cement technique like Amara's talked about, maintain their insurance for subsequent reconstruction.